This is one of those topics that we talk about so frequently in a chiropractic office, but I never feel like I actually get the time to go through it in a way that people understand it on a really, really, really deep level. And I think that's really critical, but it's something that everyone is going to have to face at a certain point in time. And that is this idea that even though our spines are amazing and they're built to protect our nervous system, just like every other part of our body, they don't last forever. And so there's this natural effect of deterioration that's going to happen over time. But why does it happen? How does it happen? What causes spinal degeneration? And is there anything you can do to slow it down if it's already began? Is it something that you're just doomed to experience, or is there a process here that can get accelerated or decelerated based on your habits and your lifestyle? So we're going to talk about spinal degeneration today and what that really means for you as an owner of a spine.
As an owner of the spine. Well, I mean, it is true. I don't feel like you think about owning a spine. Like, it's just so intrinsic. Like, it's just inside of you that most people aren't thinking of it as if it's a car or something that requires maintenance, or, you know, like even your teeth, because you're looking at your teeth, right? You're looking at the different things in your body so you can see them. So you're not thinking of yourself as really a spine owner, but you are. One of the interesting things, one of probably the worst things about spinal degeneration, right, is that it's so silent.
Yeah, the pressure, once the pressure on your spine stays concentrated long enough and it really just continues, what happens is discs begin to dehydrate, and this happens silently. Sometimes people have no idea it's even happening. Those discs begin to thin, the fibers in those discs and the nucleus of that disc begins to weaken. It loses spacing. So you've heard of disc degeneration and disc space. So that space begins to deteriorate. And then here's the dangerous part. You actually don't feel or know that that's happening as it's occurring. So it's really a wild idea. And I think that people think that frequently it's something that they're non-back pain, so everything must be healthy.
Yeah.
Right? Yeah. And then they're having pain or they're having a problem, and so it must have just shown up. Right. The only exception is the person that comes into my office and they say, no, I've been dealing with this for years and years and years. They're not surprised by that x-ray. Mm-hmm. But frequently somebody will come in and we'll take x-rays and it's an incident. I think we talked about this a few weeks ago, the proverbial picking up the pencil.
Yeah.
Right. Yeah. Or whatever it is, throwing catch with the kids or something. And all of a sudden you feel that pain. And then it doesn't go away, and it's unrelenting. And then we take an x-ray, and there's years of deterioration and damage. And the natural inclination is to think, well, I wasn't in pain 2 weeks ago, 40 years old. I've lived 40 years without any spinal pain. And last week I was throwing catch with the kids, and my back went out. And so I think it's just it's a muscle, I pulled something, maybe I pinched a nerve or whatever, but it's definitely not degeneration because I haven't felt like I'm degenerate.
I'm not a degenerate.
I'm not a spinal degenerate.
I can't have degeneration. That's not me. Yeah, no, 100%. 100%.
So the road that we want to go down is the understanding that no, the truth is your body adapts, and we live life. People are frequently like, is that normal? I'm like, no, that's abnormal. Normal is a perfect spine with 3 curves straight from front to back and beautiful, healthy discs. That's normal. Mm-hmm. Now, if you're asking me, is it common for discs to break down as we age? The answer is yeah, it's very common, but that's because abnormal stressors, things that we do every day, like we're not meant to sit 8 hours a day. We're not meant to drive in a car an hour and a half each way. You were in the car yesterday from 2 p.m. to
9:45 p.m.
I am driving from
it. I'm like, I could be in Alabama by now. Right.
Yeah, I called you yesterday and you're like, I've been in the car since 2 p.m. driving to kids' sports events. And your exact phrase was, I could have been in Alabama by now. If abnormal stress continues, what happens is the discs begin to deteriorate, and then the bones begin to actually remodel around that stress. And then what happens is it starts laying down more for lack of a better term, bone, which is calcification, and it helps to stabilize that area. It's a very primitive response. Your body's actually trying to protect you, but more bone, more calcification means more rigidity, less movement, more dysfunction. And this is where joints begin to narrow, and it's where what we call arthritis, and I say what we call because arthritis is just not a great term for what's actually going on. We'll talk about that in a second, but that doesn't happen in a weekend. It happens in years and in most cases, even decades.
And if I could pause there for a second, it happens in the moments that most people are thinking, why would I ever go to a chiropractor? I don't have neck pain and back pain.
Yeah.
Or
that's true.
Or the occasional person who's thinking, oh, those chiropractors, they just want us to come in. They just want us to come in because they just want to be busy and they just want to see more patients. Like that is the maintenance of the spine that we're talking about. That is the taking care of your spine in a way that we are keeping motion, that we are keeping, that we're keeping all of the things moving and happening inside of it that needs to happen so that you're not developing this degeneration. So if you're looking at your x-rays when you're 35, 40, 45, 50, 55, and so on. And you're saying, why do I have spinal degeneration? It's because you've never taken care of your spine.
Yeah.
You just take care of it.
Yeah. We ran into this. We run into this a lot, but we ran into it recently at the Home and Garden show where you're, stopping people and saying, hey, have you ever been to a chiropractor? Hey, have you ever had your nervous system evaluated? Hey, have you ever had your spine checked? And they're like, and you ever been to a chiropractor? Like, no. I've been lucky.
No, I'm good.
The equivalent would be like, hey, have you ever been to a dentist? And they're like, no, been lucky. Like that.
You're about to have wooden teeth like Jared.
If somebody said that, you would be like, oh, somebody please educate that person.
That's exactly what it feels inside. When we hear that response, it's like, oh gosh.
So if you're the person that it's like, if somebody were to stop you at a Home and Garden show and say, hey, have you ever been to a chiropractor? And you were to think, no, I've been lucky. So there's two pieces here. One is, yes, you have been lucky up until this point, and that luck will run out one day because things that you value, you take care of. And if you don't take care of them, then they start to lose their function and they become less valuable to you.
Is there anything in life that you value that you don't take care of?
No. And then number two is,
it would be the one outlier.
It would be the equivalent of somebody saying, hey, have you ever had your teeth checked? You ever been to a dentist? And you're like, no, I've been lucky. Literally everyone around you should be like aghast and they should look at you like, oh my God, you've never been to a dentist? Like, what are you doing? Like,
right.
You know what I mean? And so that's just the mindset we have. But here's why. It's not just your joints. It's not just your discs. That degeneration eventually affects, and even sometimes immediately affects, nerves. And this is where, it gets complicated because every vertebra surrounds and protects a pair of spinal nerves. Actually two pair, one pair above and one pair below. So two vertebrae come together and there's these outlets that occur between the vertebra. They're called foramina, and that every vertebra surrounds and protects a nerve. So when degeneration occurs, it starts causing narrowing of the space where that nerve exits, and it starts creating restriction and pressure on that nerve. And so people would think, well, if that was happening, and I think this is where the no, I'm good, been lucky, is they think that if you had pressure on a nerve, you'd feel it. But the reality is you don't feel it. Like a cavity. When you have a cavity in your tooth, when do you feel it? Do you feel it at the beginning or do you feel it at the end? And by the time it's at the end, half the time they're either hopefully filling the tooth, but maybe pulling that tooth. And so the reality is you can't pull a vertebra. You can't pull a vertebra. You only get so many. And like the best case scenario, when it gets really, really, really bad, is that you hope if they do fuse them together, they don't do it in such a way where there's continuous damage on that nerve. But by the time you've gotten to that, you're just at fate's hand. Your opportunity to correct that was way before that. But the reason we look at people like, what are you talking about? Is because pressure on a nerve is a small thing with big consequences. That nerve might go to your heart. So that nerve might control your immune system. That nerve might go to your gallbladder. Well, Dr. Ryan, I don't have a gallbladder. That's because that nerve deteriorated. No, my doctor said my gallbladder was backed up. Yeah, because the nerve supply controlling your gallbladder became so compromised that your gallbladder started dysfunctioning, and then it started to back up, and then pulled your gallbladder out. Dr. Ryan, I don't have an appendix anymore. Yeah, because your appendix became so weak due to improper flow through that nerve that your appendix could no longer fend for itself and fight off infection. So it became overwhelmed with infection, and it started to become abscessed. And then if it ruptured, you could get sepsis and die. But it all started with a nerve problem. So like when we talk about these nerves and we talk about this communication through nerve pathways being altered, we take this as a very serious thing. And so it's very foreign to me when somebody goes, never been to a chiropractor, like don't have debilitating pain yet, I'm not using a cane, didn't throw out my back. They don't understand a bigger underlying concept, which is they're living a life that is going to create this damage and stress on their spine. And their only hope of offsetting that is to keep healthy movement, function, and position in this beautiful structure that God gave them.
I think the reason that we have so many, if you go back and listen to so many podcast episodes that we've done, we have so many conversations about the core philosophy that each of us has in terms of health. And if you don't, if you can't right now go, oh, here is my core philosophy from health, right? Then you have one. It's just probably been something that's just you've just accumulated by hearing the common narrative over time, right? And I've been in that situation before, so no judgment of being in that situation, right? But here's the interesting thing is that when we have that discussion so many times, because when it comes to situations like this, where when a doctor comes to you and says, oh, you just have a bad gallbladder, or, oh, you just have a bad appendix, we just need to take it out.
You just have a bad back.
You just need surgery. Like that's just what it is. Like this is what the issue is. The reason why we have that conversation so many times is so that you can hear that, and there's something inside of you that like, I almost imagine, do you know when you're listening to music and like a little kid playing the piano and they just smash on the keys and all the notes clash? There should be something inside of you that just clangs like that goes, that's not right. Like I don't, and for some, you don't even have to know what is right, but you could just know that ain't it. Like that is not it. I don't know what it is, but I know that it's not that. And so that is the reason why we have those discussions so many times, so that when you're in that situation, you can go, no, I'm not buying what you're selling here. It's not that I just was born with a really crappy appendix or a really garbage gallbladder or, whatever that is. So you can go, we really need to get to the bottom of why this is happening. And that term root cause, I just want to take it out to the dumpster. What does Count Over say? I want to take it behind the dumpster and shit.
The woodshed.
The woodshed, right? Because I do feel like it's been genuinely, really inappropriately used in the last, 5 years, especially 10 years, maybe, right?
Elaborate.
But because there's a lot of people that go, we got to get to the root cause. Here, take this supplement that I'm selling you. We got to get to the root cause. Come here, let me draw your blood and send it away for testing so that we can find out what your imbalances are. And then that's going to be how we figure out what the root cause is. And the interesting thing is that the nerves are the foundation of it all.
The root cause of all function. Okay, so the root cause of why you're breathing right now, the root cause of your heart beating right now, the root cause of cells continuing to grow is your nervous system. I mean, if you want to take it back one step further, it might be God breathed life into man and we have life. But I mean, as far as physiologically and what we know through science, like the root cause of all healing, the root cause of all function is neurological. And this is why, we get the patients that come into the office and they'll say things like, I was picking up the laundry basket the other day. And, that's when it happened. And I'm like, you were picking up a laundry basket. So like, I mean, you look like you're, and it could be someone who's in good shape. They're fit, like they lift weights, whatever. It's like, what did the laundry basket have in their leg blocks? Like, what was going on? They're like, no, actually it was empty. I'm like, you sure it was a laundry basket? Or was it the last straw? You know what I mean? Was it the laundry basket? Healthy tissue doesn't fail under normal circumstances. So then I start looking at, strong joints. They're not going to collapse from tying your shoe. What usually happens is this: the area has been compromised for years. It was the, 3 CrossFit workouts a week for the last several decades. And I'm not saying CrossFit's bad. I'm just saying all that movement, all that function, if you're not taking care of your spine, it would be the equivalent of you eat 3 meals a day, a couple snacks a day, you drink a protein shake, you do whatever, but you never brush your teeth. Like, what do you expect to happen? Right. And so if you're doing all this movement, or maybe it's not. Maybe you're not the weekend warrior or the CrossFit athlete, but maybe you sit in a desk. You at a desk for 8 hours a day. You drive 40 minutes to work each way, and then you get home and you sit on the couch. And maybe it's that sitting that's compromised everything for you. So discs thin, motion gets lost, bones remodel, weakness builds silently, and then one day you twist to pick up the laundry basket, empty by the way. You lift, maybe you sneeze, and then boom, it happens. But that didn't start that day. It started when you started moving as a human being. Right. And your spine is something that you really need to be taking care of. And I've realized this I've been a chiropractic patient for well over 30 years. I mean, I started chiropractic care when I was 8 years old. And that's something I want to talk a little bit about too, is like, why should kids get adjusted? But if you're over 30 and you've never had a structural evaluation of your spine, now is the time to stop and go, whoa, like I take care of my teeth better than I take care of the system that protects my spinal cord, my nerves, and the lifeline to my body. There's a strong possibility that degeneration is already setting in, not because you did something wrong, but because gravity's gone undefeated, because life is repetitive, because most people never correct small misalignments as they happen. They turn into bigger ones. And then those small problems, when they're left alone, they turn into real structural, significant issues that begin to break down and degenerate over time.
I think I would be remiss if I didn't say right there, like if something hits you right there and you live in the Cincinnati area and you want to come get your spine checked out, you're welcome to come to our
I know office. A place.
Right. We know a place. You can give us a call. It's 513-777-7575. Or you can go right online to our website. You can book an appointment right there on our website, AlionHealthCenter.com. That's an easy one. You can also, if you're not in the Cincinnati area, shoot us an email. You can go on that website, shoot us an email. Our email address is right there, and we can help you find a chiropractor, structural corrective care chiropractor near you that can definitely help you out.
We were working with some patients last night, and I heard a conversation, one of our doctors was having with an elderly gentleman, and he was like, well, I'm 72 years old. I mean, what are you going to, isn't that supposed to look like that? The answer is like, heck no, it's not supposed to look like that. Yeah. There are 72-year-old individuals with really healthy spines. Not only that, you're 72 years old. What if you live to be 90? What's it going to look like after another 18 years? Mm-hmm. And that would be the immediate question I would ask them. I'm 72 years old. Shouldn't it look like that? I'm like, no, it shouldn't. And if you happen to live 18 more years, it's going to look a heck of a lot worse. So do you want to work on it now, or do you want to suffer for those next 18 years? Because there are stages to degeneration. The early stages are still pretty functional. That's how people can be moving around and they don't even know what's happening. They don't know that degeneration is starting to occur. Discs are starting to get thinner. Bones are starting to malform. Bone spurs are starting to show up. Motion can still be restored at that point. Pressure can be normalized. Those nerves can heal and thrive. Communication can improve as the brain is signaling all those organs to those nerves. But later stages involve structural remodeling that simply can't be reversed. Now, it doesn't mean we still can't help those patients. Mm-hmm. It doesn't mean we still can't stop it from getting worse. And it doesn't mean that they can't get some mobility and some healing back. But that's the difference between protecting a spine and managing damage.
Right. And I think that's a fair question right there. Would you rather protect your spine or would you rather manage damage?
Yeah.
I mean, that's at the end of the day, that's what it all boils down to.
I mean, there are lots of people on pain management. Mm-hmm. And even to that regard, chiropractic care can get to the point where it becomes pain management. Right. But it's non-allopathic, pretty much risk-free, non-liver destroying pain management. I mean, you're not taking medication that if you get hooked on it, you're going to be fiending for a fix and going, to try to get a refill before you're even allowed to. It's not a controlled substance. Chiropractic isn't a controlled substance.
Right.
Nobody's telling you how often you need to get adjusted. There's no abnormal effect to getting more chiropractic care. There's no ill effect. It's just such a beautiful thing that if you're in pain, you can get adjusted more. But if you're under pain management, you can't take more Oxycontin. I mean, you could, but it's not going to go well. You can't take more anti-inflammatories. You could, but you're going to blow out your liver. And
Right.
Even when it gets to that step, chiropractic's still a better choice.
And it's so interesting to me. Like, why would they not? Why would all of the opposing forces to chiropractic? Why would a pharmaceutical industry that creates all those drugs that manage your pain, right? Why would they not want to convince you that chiropractic is dangerous, so that you shouldn't do it, and then it's really only to help out with neck pain and back pain for a few visits, and just go try it and come get us pharmaceuticals? I mean, why would they not? Of course they would want to. Of course they would want to convince everybody that it's not something that you go to and do.
Oh yeah. I thought you were saying, why would they not want to tell people about chiropractic? And I was like,
100%.
No, they want you hooked on medication. They hand it for the rest of your life. That's expensive, and your insurance may pay for, and they want you using that. Unfortunately, we've seen that to the nth degree go so far that it literally kills people. Literally kills people. Spinal degeneration kills people. It kills people two ways. It kills people by shutting down their nervous systems and ruining their lives before they get to live them out to their fullest potential. And it also kills people because people get on medication that literally shuts down their health. It kills them. And here's the thing is, this doesn't happen exclusively in adults.
Mm-hmm.
In fact, I would say for many adults, the pain you're feeling now, I used to say this frequently, and I don't think that everyone really got it the way I was trying to get it. It's a very powerful statement, but it requires a little bit of knowledge about this. So I think chiropractic patients who use chiropractic regularly, if I were to say this, they'd be like, oh, that makes sense. But someone, if you're a novice to chiropractic, you're like, what do you mean by that? And that is subluxations and degeneration of your spine is a pediatric problem that manifests itself in geriatric populations. It is a pediatric problem that doesn't show up until you're in a geriatric situation, sometimes sooner, but definitely in geriatric populations. So what do I mean by that? For many adults, it started in childhood. It started with your birth. Believe it or not, it can go all the way back to your birth. The worst necks I've seen in 70-year-olds were probably from their own birth process, that they were yanked out of the womb via C-section or forceps, and their neck has been bad their whole life, which is why their health history has been bad their whole life, which is why their posture has been bad their whole life, which is why their spine has been degenerating their whole life, because falls when you're learning to walk, sports collisions, football, tackling, head first, backpacks, for crying out loud. These backpacks are so heavy. Posture during growth years, now video games and iPhones, looking down. If a child develops a subluxation that never gets corrected, that segment will grow under abnormal mechanics for decades and decades until it finally becomes so obvious and so glaring that it doesn't look like a pediatric problem anymore. Now it looks like a fossil. It looks like a dinosaur bone on X-ray. And they're like not thinking like that happened when I was a kid, because everything looks so deteriorated and so malformed. But what we see in a 45-year-old with degeneration didn't suddenly appear at 45. That was a 45-year-old who didn't get adjusted when they were 10, when they were 8, when they were 12. And so one of the reasons when patients come into our office and they see all these kids running around, they're like, what, you guys see kids? You see babies? Why do you see babies? Because we want these kids healthy for the rest of their lives. And you're 45 years old and on your intake form, you said you're on 7 medications and your pain in your lower back is 7 out of 10, and you got numbness in your hands. When do you think that started? When do you think that started? You think it started last week? You think it started, 2 years ago? No, it started when you were a kid, and chiropractic care is one of the best. If you want, as a parent, and this is a strong statement as well, but this is a write her down, or at least take mental note of this and share it with your spouse later. But if you want to do something for your kids that next to guarantees that they're going to have the best expression of their health for the rest of their life, when they're out of your zone of influence, right? then from 0 to 18 years old, get them adjusted every week of their life. Bare minimum every other week.
100%.
Get them adjusted regularly from birth till 18 years of age. And that foundation, if they never got adjusted again, you gave them almost 20 years head start on everyone else in terms of their health.
Right. And there's so many things that can run through your brain, right? When you say that, it's like, what are the things that you want to instill in your kids for, you only get 18 years. And what's wild is that the day that our kids were born, I thought 18 years was forever. Like it seems like eternity.
I just thought of this one. You ready? The adult spine your kids will have is being formed now.
Absolutely. Absolutely.
The expression of their nervous system that they'll have as adults is being formed now. The health that they'll have is being formed now. And their spinal posture and their movement, their mechanics, that is being formed right now.
1,000%.
Yeah, and 18 years goes by.
It goes by like a blink. And what's interesting is that, like, when you look at that, when, you've seen those things, I've seen those charts that say, like, that's 18 summers, and it's like X amount of...
I thought you just said Epstein, those charts. I was like, what did you just say?
What?
You said, I've seen those charts. Sorry. You can tell what I've been paying attention to.
What's been called? Oh, God bless America.
Sorry.
But when you look at those, you see that there's a limited number of expression, right? Our oldest just started high school this year. And I'm like, there's a limited amount of time that you're going to get to go to youth group. You know what I'm saying? Like,
sure.
Like you got a window now. Like, there's a limited amount of time where we got we got a limited number of spring breaks. We got a limited number of summers that are left. We got a limited number of time left that we're doing. And when you're thinking about it, it's like, what would the priority be? Is it how many supplements I can shove down their throat? Right.
Yeah.
And listen, is there a benefit? Yeah. Do we take supplements? Yeah. Do our kids take supplements? Sure. Right. But when you're looking at it in the hierarchy of what are the things that are going to be most impactful to them, when you talk about,
there's a limited amount of times we get to say no to junk food and get them eating healthy meals.
Right.
There's a limited time of times that we'll get to work out as a family.
Right.
There is a limited amount of adjustments that they will have during their youth.
Yeah.
And if we rob them of half of those.
Absolutely.
You know what I mean?
Absolutely.
And like, listen, if you're a parent, and your kids have never been adjusted, I'm not saying that to say you're robbing them of that, but now that don't rob them of it.
Right.
Don't rob them of it. That you have an opportunity to really impact their life in a dramatic way. The question isn't, does my kid have pain?
Right.
They don't see it. Why would my kid see a chiropractor who doesn't have pain? Or, we get this, like 4 kids in a family. We'll get this one checked because he plays football.
Oh, yeah. Which is good.
The question is their spine developing under healthy movement, healthy alignment, and healthy nerve function? That's the question. Can you take an x-ray of my kid so I can see if their spine is developing well? Mm-hmm. Can you take an x-ray of my kid so that we can know how much we need to be protecting this thing that got placed in the center of their body that protects literally the foundation of their health?
And at some point in time, people did understand the importance of the spinal structure, right? I mean, I remember, I think it was like 4th grade, that when we were in school, I remember getting a scoliosis check by the nurse.
Yeah.
Do you remember that? I mean, I think you had to go in, you like bend over or something, and
Adam's test.
And the nurse
basically touch your toes and see if there's one side of your back that looks higher than the other.
Yeah, and I remember doing that, right? I remember.
And the funny thing is, you can only see about 60 to 70% of scoliosis is do an Adam's test. So there's 30% of them that go miss. And then the worst part is, what do they do after you get a scoliosis check if they suspect scoliosis? Go to your medical doctor, who doesn't do a damn thing about scoliosis. Like they don't do anything. Yeah. They literally don't do anything. They just say, well, let's, take an x-ray next year, see if it's worse.
Right.
And then it's getting worse. They're like, well, it's worse. So let's take an x-ray next year and see if it's worse.
Yeah.
And then it gets to the point where now it's beyond, comprehension how we let it get to this point. It's not correctable. And they go, well, now we're going to recommend you go to a surgeon. They're going to fillet you open on the back from neck to butt. And they're going to put 2 rods in there and try to torque everything back into position and put screws all up and down your spine. And you literally can't move. You literally can't move other than your arms and your legs. You can't bend over. You can't turn. You can't play golf. These kids, sports is over.
Mm-hmm. Right.
And that's the answer. That's the medical answer. So even in school, when we were concerned about the spine.
Right.
The answer was go to the person who has no clue.
Right.
And then wait until it's so bad that your only hope, quote unquote, is surgical. And that's just so crazy. And then as an adult, like, even if it wasn't that bad, they're just looking for the worst.
Yeah.
Right. And so you bend over and your back isn't high on one side compared to the other. But if I were to take an x-ray, what if you're missing 50% of your neck and thoracic curve, and you have two vertebrae that are like grossly out of alignment that you and I could see on an x-ray, but you can't see it from outside? What if that kid's then, like, they're going to lose their gallbladder, their tonsils, they've had chronic ear infections, and all these health issues nobody's taught them are tied to subluxations, creating interference with the nerves.
Yeah.
Again, do we treat ear infections and tonsillitis, and can we save your gallbladder? I don't know. But what we do know is that if that vertebra is putting pressure on a nerve and you don't get that corrected, then what happens over time is more disc thinning, more stiffness, more joint narrowing. It feels like tightness is becoming just chronic and normal for you. And then what could have been corrected early now becomes something, again, going back to that word, that we're simply managing. And here's the problem is time isn't neutral. Time actually magnifies things.
Yeah.
So the sooner the problem develops, time just magnifies that problem. So you don't need to wait to make this important. In fact, I would say make it important and don't wait. Like, get in as soon as you possibly can. Get your kids checked. If your spine's a wreck, and you know, I mean, we used to the old, I mean, not joke, but patients would say sometimes like, well, I think it's too late for me. Look at my spine. And I would say, we can still manage this. We can still help you. We can still help you feel better. You're going to love chiropractic care, but you shouldn't be asking, can you correct that? Because the answer is no. What you should be asking is, how do I make sure my grandkids never look like that? How do I make sure, you know, my grandkids are on, you know, like, what are you saving out so you can leave them a little bit of money one day after retirement? And maybe they can pay off, you know, a couple $1,000s of their college debt or something. No, give those kids the best expression of their life now. Pay for your grandkids to get checked. I love it when we get this happening frequently, that dads and moms will come in, they'll raise their kids under chiropractic care. I can think of 2 patients right now that raised their children under chiropractic care. One of their gifts to their kids and their kids' children's first year of life. So now their grandkids was, we want to pay for your child's chiropractic care. So, I mean, for me, that was like a home run. You know what I mean? It was like, we got it. We got, you know, Russ Stinson, his daughters had their kids, and now their kids are under chiropractic care. Like, for me, that was huge. Knowing the baseline, knowing what your spine should look like, knowing how it should function. If I were to ask you guys right now, what is your neck curve? What's the measurement of your neck curve? You're like, I've never thought about my neck curve.
Right.
Or what's a neck curve?
Yeah. Yeah. What's it?
What do you mean curve? Is it supposed to be straight?
Yeah.
From front to back it should, but from the side it's supposed to have a curve. And your neck curvature by neurologists used to be referred to as the arc of life.
Yeah.
Meaning all the signals that control all of the life to all of the organs has to go through this curvature in your neck. You have something in your body, your spinal cord, that is akin but even way more impressive than fiber optics. That you have this nerve tissue that we can't recreate ourselves. It has fluid, it has fat, it's firing signals at hundreds of miles an hour, millions of them every second. And we can't even recreate that yet. But what we do know is within fiber optic cables, if you bend a fiber optic cable beyond 45 degrees, you start damaging the fibers to the point where that network, that internet network will lose its signal strength over time. And if you guys know anybody that works, trust me on this, or go ask them, that you can't do that with Cat5 cable, fiber optic cable. You can't bend it too much. If your neck curve is bent the wrong direction, or it's straight, or it's compromised in some way, your ideal 40 to 45 degree neck curve, if that's straight and you've lost 40 degrees of curve, you're losing your signals through your network. You're not Wi-Fi. Thank God you're not Wi-Fi. Could you imagine? What if you didn't have the password? Or what if
What if you're in the mountains?
Yeah, or what if something big got in the way or whatever, thank God you're not Wi-Fi. You're hardwired, but you're not immune to these concepts of there are certain things that just are true about how your nervous system functions. And so when we get into this, like degeneration, if you got a bad disc and a bone spur and it's closing off the hole where a nerve exits, you may not feel that, but what if that nerve goes to your heart? What if it goes to your liver?
Oh my gosh.
Right? You're like, well, my family has a history of liver problems. Do they have a history of liver problems, or do they have similar spines and similar posture?
Mm-hmm.
And did they grow up on a similar couch?
Mm-hmm.
Right? Did they have similar habits? My family, we all played hockey. In hockey, you bend over from a certain point in your spine. We call it hockey spine.
Yeah.
Like, you're susceptible to more breakdown in certain areas of your spine. Talk to any hockey player. They'll tell you their lower back, particularly their upper lower back, is pretty beat up from bending over a hockey stick.
Yeah.
Like, it's hockey posture. So it's like, oh, your family had blah, 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 blah. Well, did they have that, or did they have hockey posture? Right? It'd be like growing up in a family and you guys only ate processed food and you didn't exercise.
Yep.
You're like, well, everybody in my family's overweight. Well, no joke. No kidding, because everybody in your family is eating processed food, not exercising.
Yeah.
So it's not genetics, it's lifestyle. And chiropractic families get to say things like this. Everybody in my family gets over things pretty quickly when they get sick.
Mm-hmm.
Everybody in my family has never used an antibiotic.
Yep.
Everybody in my family still exercises late into their 60s and 70s.
Mm-hmm.
Everybody in my family sleeps really good.
Yeah.
Like, these are the beautiful things that people in our chiropractic care say. And that's what we want for people, but it starts when you know, and that it doesn't have to end. And degeneration, this whole thing we're talking about, I would love if chiropractic ruled the world. Thinking like Nas. Chiropractic ruled the world. There would be no more spinal degeneration. I mean, there would be from trauma.
Sure.
But there wouldn't be from just life.
Right.
And if chiropractic ruled the world, then we would see a healthier population who wasn't falling apart in their 50s, who wasn't miserable in their 60s, and who wasn't hoping they didn't live 10 more years in their 70s. You would see people vibrant, healthy, moving around. You would see grandparents playing with their grandkids at the park. Not sitting on the bench and asking, when are we leaving?
Mm-hmm.
But like out there, actually on the play set, maybe on the monkey bars, maybe doing, how cool would that be, seeing grandpa on the monkey bars? Right. And that's that vision, but that doesn't happen by accident. It's this slow, silent whisper that you can't ignore and that you need to be very conscious of. So if this is a question that you have, is my spine under stress? First of all, the answer is yes. Life is abnormally stressful. But if you want to know, if you want to see what it looks like, you want to go, Dr. M, what does my arc of life look like? What does my neck curve look like? How much degeneration do I have? You said there's stages. What stage am I in? Am I in stage 1 or am I in stage 4? And you want to know that, then give our office a call. Check us out online, healthcenter.com. Or give us a call at 513-777-7575. Again, if you're not in our area, we'll help you find a chiropractor in your area. We know hundreds and hundreds and hundreds of them, and we'd love to help you just really live out your best health and, ward off that inevitable degeneration that wants to settle in, and help you really understand how to keep that at bay for as long as you possibly can so you can enjoy your life.